we're live now.
Okay, hi everyone. Welcome back to another session with Predental Universe. I'm Tiffany, one of the predental students monitoring today's session, along with Sherry. We have an exciting presentation today with Dr. Shivani, all the way from England. So with that said, the floor is yours whenever you're ready, Dr. Shivani. Oh, you're actually on mute.
Brilliant. Hi, everyone. Sorry about the delay. We're just having a few technical difficulties there, but I hope everyone's having a nice Easter weekend and hope the sun is shining where you are. It's really nice where we are at the moment. So because we were having problems with my camera, what I'm going to do is actually just share my screen so you can see my presentation. Unfortunately, you won't be able to see me, but I'm happy to basically answer questions afterwards. So my name is Dr. Shivani. I'm a dentist with a special interest in minimally invasive cosmetic dentistry. And I'm also an advanced facial aesthetics doctor. So first of all, I just want to say thank you so much to Sherry for getting in touch with me, and to Predental Universe as well for having me, and for giving me the opportunity to help predental students.
Thank you so much, Dr. Shivani, for joining us. It's an honor to have you today.
Brilliant. Okay, so today I'm looking forward to giving you all some background about me and sharing my journey of becoming a cosmetic dentist. And I will be giving you a small insight of my day-to-day and show you some cases of how cosmetic dentistry really can change lives. I hope that my presentation can inspire, help, and provide a good learning opportunity for you. So just a little bit about myself. I was born in a small town called Keighley in West Yorkshire. I don't know if anyone's heard of it, but some of you may have spotted my Yorkshire accent. My parents had their own successful kitchen and bathroom business growing up. I went to a private school. I was very academic, got all A's and A stars. And I was quite nerdy, and you might just see this little picture of me. I got selected to go on this chemistry camp. That was the only one in the school for a couple of years, so I was quite nerdy. And then growing up, I didn't really know for sure what I wanted to do. And everyone in my family was, like I said, business orientated, but I knew that I didn't want to go into the family business. So I remember going on some career fairs. I don't know if some of you may have been on some as well, just to get inspiration. I know that I loved maths and sciences, and I loved helping people. So I thought I'll do medicine. My parents, being Asian as well, quite happy when I said that. So I did some work experience in a gynecology ward to start with, then went on a study weekend actually with an organisation called MedLink, and they gave us a lot of background training, around medicine. They gave us stethoscope training, and we were introduced to mentors. But fortunately, I quickly began to realise that this wasn't the career for me. I then felt a bit lost, and I thought I'd look into dentistry. Then one of my mum's friends, who was a dentist, recommended that I did work experience with a dentist they knew called Dr. Sanjay Gautam, who is a cosmetic dentist, and also a dentist called Dr. Naresh Sharma, and he's one of England's leading implant surgeons. And I really loved it. I loved the experience. I remember asking them so many questions and got a real buzz, from shadowing them. And I began to picture myself as a dentist. I also did work experience in a dental lab as well, which really helped me to understand that part of dentistry. So in England, I think it works a little bit different to the USA, but in England, you can apply to 4 dental schools. and you do it via a company called UCAS. And I applied to Leeds, London, Newcastle, and Liverpool. Leeds was the one I wanted to get into because it had a good reputation, it had good clinical facilities, and it was quite good for learning, and it's quite near where I lived as well. Then luckily I managed to get interview stage very quickly for all of them. And in preparation for the interviews, I did a lot of research on current topics in the news. So especially like, for example, here in the UK, at the moment, turkey teeth is quite a hot topic, and dental disease in children as well. So when I say turkey teeth, I don't know if some of you may understand, that unfortunately there are some places maybe in Turkey that are doing heavy prep dentistry on people that's, some people that don't need it. And it's quite a trend actually at the moment. And so throughout my work experience, I got to understand some dental terminology as well. And I remember my first interview was with Newcastle University, and I was really nervous, but also excited as well and keen to impress them. And I remember one of the questions they asked me was, what are your thoughts on teeth whitening? And I managed to come up with an answer, but actually after the interview, I had a few doubts and I wasn't really sure if I'd answered the questions properly. And then a few days later, surprisingly, I got a letter back from Newcastle, and a couple of days later from Leeds as well, and they all offered me conditional offers. So it all went really well for me, and I didn't really have any kind of problems at that kind of stage. And when I look back and think, why did they choose me? How did I get offers? Because a couple of my friends didn't. And then I thought, it's probably my grades, but also my passion as well. Because one of my friends had very similar grades to me and she didn't get any offers. But I think it could be my passion and enthusiasm to learn, and also maybe my personality as well. So just changing on to the next slide. So I remember starting dental school. So I went to Leeds University, and it was the first time living away from home. So there were a lot of new faces, and there were a steep learning curve, huge amounts of information being thrown at us. And I remember at first feeling quite overwhelmed. And in particular, actually, I remember this assignment that we were given, and I was graded a grade C. So I don't know how it works in the USA, but it's just like 2 grades down from an A. But because I was so used to getting A's, it was a big shock for me. And it completely actually knocked my confidence down and my enthusiasm as well. And I actually went through quite a low patch, I would say. I lost loads of weight. I started to focus more on like the social scene, and I also lost a bit of interest as well on the academic side. I, however, did enjoy undergraduate, so it wasn't all bad. And I did make some really good friends, and I used to love helping younger students, in particular, who used to come out and reach out to me. I also joined the committee as well, which was great, and became the charity rep as well. That's a little picture of me back in the day. And around 4th year, really, that's when we started to do more sort of advanced clinical work. And I remember my finals case was the full mouth rehabilitation case. That's when I remember, it's really the enthusiasm started to come back, and I started to really enjoy it again. But and overall, Leeds University was a great university. Don't get me wrong. The facilities are next to none. I felt, however, there were a few areas that where they didn't really cover. So they didn't really cover much about cosmetic dentistry, the business side as well, and the finances. Just looking back, I feel if there's one thing they could have covered more of, it's that kind of section. So I then did a year of vocational training. So and it was mostly NHS practice, and it was in Bradford, so also in West Yorkshire, with a doctor called Dr. Justina, who's a general dentist, and he mentored me. And I really loved this VT year because I got to work in a practice. I had my own surgery. There were no targets. We had one day a week where we would meet our peers as well. And I gained a lot of experience in the core aspects of dentistry. Then, after my VT year, I carried on as an NHS dentist. And I hope when I say NHS as well, you understand, I'm sure you understand that's National Health Service in England. And basically the way it works for dentists is that you set a target and you get paid on a unit of dental activity basis. So after my VT year, I carried on as the NHS dentist, like I said, and I joined the British Academy of Cosmetic Dentistry, BACD, and I did a part-time year-long course called Cosmetic Dental Seminars with a really great doctor called Professor Ian Klein, and this was great for me as I got to meet like-minded people. And after the course, I realised I definitely wanted to be a cosmetic dentist. I then got married. I had a baby boy, and I took a couple of months off work. And then I moved to a more modern practice with better facilities around Keighley, so near where we live. I then invested in a new camera and some photography equipment. And I also did a course by Manesh Patel, it was, on photography. So photography was a key thing for me. The more I took photos, the more I was able to see my work in detail and critique it. And this made me want to do even better. And it's actually now something that I really enjoy. I then signed up to Invisalign. So I'm sure you all know what Invisalign is. It's the world's leading clear aligner system. And I also did a few courses on composite bonding. I then started to do simple align, bleach and bond cases. And I remember I completed my first align, bleach and bond case and just seeing how happy it made my patient and how much it affected his confidence. And it was amazing for me. And the more cases I did, the more I began to realise how special cosmetic dentistry really is, and the power of a smile and how it can really affect someone and change their life. I then set up my page on Instagram. So I don't know, some of you may have seen it. It's not like massive following, not a huge amount of posts, but so Instagram, I would say, can be a great learning platform, but there's a lot of smoke and mirrors. Most people only post about positives and don't always see the work that goes behind each case. I then did some training after that with Derma Medical. So that was in London on Harley Street, and I became an advanced facial aesthetics doctor. I found this really helped me understand the full face in a lot of detail and how I can change certain aspects using fillers and Botox. And it integrated really well with my current work I was doing with dental cosmetics. Early this year, I also invested in my own digital scanner. I got an iTerra scanner and also became a DSD Gold member. I'm also now working on 2 postgraduate diplomas. One is in restorative and aesthetic dentistry, and one is in clear aligner therapy. During lockdown last year, I started integrating Baji as well. So Baji is basically it's a global award-winning skincare brand, which you may have heard of as well. And I found that it would work well with facial aesthetics. And they also introduced something like a direct-to-patient service. So at the time, it worked really well because patients were able to kind of carry on with their skin regimes or start new skin regimes without having to leave their house. So earlier this year as well, I completed a course with Dr. Sam Jethwa. So he's a leading cosmetic dentist in London, and he specialises mainly in handmade trial smiles and porcelain veneers. And I will show you a case that he mentored me with. And then gradually I dropped my NHS contract further, and as a result, I am a lot happier, and I have more time doing more of the things I really enjoy, and more time really to manage patient expectations, and I enjoy my work more as well as a result. So the smile. So the smile is a beautiful thing, and each smile is unique. There are also many benefits of smiling. So one is that smiling relieves stress. It boosts your immune system. It improves your mood by releasing neurotransmitters that make us feel good. It's attractive. Smiling is also contagious, and it makes other people feel happy too. And it also helps create better relationships. So there's many benefits of smiling. And that is basically what the patient sees. And that's what the patient wants. But it's our job not only to give them that, but to ethically meet, not only is it to ethically meet their aesthetic expectations, but it's also to make sure that the smile functions as well and also lasts. So I love this definition by Tuetel about what cosmetic dentistry is. And they say cosmetic dentistry incorporates biological considerations to achieve the ideal function and emulate the pristine natural dentition with a view to long-term performance and survival. So basically that takes us nicely onto something else which I'm quite passionate about, and that is the patient experience. So this is, like I said, something that's really important to me and my team. So with nearly all of dental work, teamwork is the most important thing. Teamwork is what I say makes the dream work. And each member has their own certain roles, from the receptionist to the treatment coordinators, to the nurses, to the manager, to the cleaners, the dentist, the lab. Everyone plays a critical role in the patient journey. And what patients, I feel, need is, along with a good skill set and good artistry, is good communication, empathy, and a friendly, enthusiastic, caring, efficient, and professional customer service. And that's just a little bit, that's my surgery. Don't know if you can see. So I've got the scanner, I've got the screen, got a photo setup as well. And it's all in the patient experience. Patients see all this, they notice all this, and it just creates a nice kind of experience for them. So there are also so many technological advancements in dentistry. So our patients get very impressed, like I said, by our iTero scanner, and they love being able to see their teeth on screen in detail, and find it's a great, and we find it's a great way really to, it's a great communication tool, and it's also more comfortable for patients having scans and impressions, and it also increases the speed of lab processing. So typically with all my Invisalign cases, I only scan them, and for most restorative cases as well, I've reverted to scanning bar porcelain veneers. So we also do virtual consultations, and we use the Zoom setup for them, and we also use something called dental monitoring, which is basically a virtual monitoring system, and we use this for our Invisalign patients. So this means that chairside time is reduced, and it also very convenient for patients, and especially through this pandemic, it's been a lifesaver because it's meant that patients can continue their Invisalign, without having to come to the practice. So I wanted to discuss some cases. So before I do that, have we got any kind of questions or anything that anyone, wants to ask?
Not currently, but we're going to save the questions towards the end. Thank you.
Cool, brilliant. Okay, so this is a case. This is a patient of ours that is 25 years old, He's a business owner, and he came to me and he said that, you know, his major complaint was that he didn't like his smile and avoided smiling, especially in photos. And he wanted whiter and straighter teeth and basically show more teeth when he smiled. And the kind of look he wanted was between a natural and Hollywood. And I always ask that question, you know, I always kind of explain to patients what those kind of looks are as well. So he wanted more of between natural and Hollywood. So a Hollywood smile to me is a wide smile, a wider smile, and a more squarer, more squarer teeth as well, and smaller, what we call embrasure spaces. So the first thing we did was a consultation. And in this consultation, I got to basically understand him as a person, why he wants his teeth done, how it affects him, and basically just to gauge his expectations of treatment. We then discussed his treatment options. So we did a full smile facial analysis first, an orthodontic assessment. We did don't know how to go back. We did some x-rays and and an oral health assessment. Let's try and get rid of this if we can. And then we discussed his treatment options. So for him, we discussed clear aligner therapy versus conventional fixed wire orthodontics. And we also discussed restorative options as well, including the risks and benefits. And then we got his consent, and consent really is a very important part of the process. It's not just a signature on a piece of paper. It's really important to make sure the patient understands all the limitations, the risks and benefits. So that's something quite important. So I'll just play this video as well. I'm sorry, don't know how we go back. Not sure if I can play that. Yeah, brilliant. So this is his treatment plan. So his treatment was ABB, align, bleach, and bond. So we aligned his teeth using Invisalign Go. We whitened his teeth using Enlighten whitening. And we also used composite bonding on the edges of his top anterior teeth. And then once we did that, we gave him a fixed wire retainer, which went at the back of his teeth, and also 3 sets of Vivera retainers. And Vivera retainers are great retainers. There's a huge amount of research behind them, which basically show how well they work. So this is his reveal. I don't know if you can hear it, but that's him seeing his teeth. I don't know if you can hear that.
We can't hear him, but we can see his reaction.
Oh, you can't hear it? Okay, fine. Okay, so I'll just go on to... So the reveal really is, one of my favourite parts. I love seeing that initial reaction. So I love capturing it as well on video, and looking back, it just makes it so special. Okay, so these are his before and afters. So you can see the change. So you can see that his teeth are whiter. He's got a wider smile. His teeth are more squarer. That tooth that kind of disappears behind his lower arch has also come forward. And also, you may notice as well that his teeth are cleaner, and his gums are healthier as well. So not only does orthodontics help with the way the teeth look, but also in his case, it's given him more of a stable bite, and it's also helped him, be, more able to clean his teeth better. He doesn't find flossing as difficult, and because his teeth look better as well, he's got more motivation to kind of keep them clean, and they're more visible. So health benefits as well. And this is just a facial view as well. And you can really see he's a lot more happier, and he's also a lot more confident as well. So the second case is another patient of mine. So she is called Shona. She's 32 years old. She owns a hair salon, and she came to me because she hated her smile. She wanted her teeth to be whiter and more straighter. And she also said that since she had lip fillers done, and these were done elsewhere, she noticed that her teeth weren't as visible. And she also didn't like what she called her sweet corn tooth. And basically, that sweet corn tooth is her baby tooth. And it had broken and was actually starting to move. And that was a trigger for her coming to see me. And she said she wanted the Hollywood look, so she wanted a really glam smile. So same as like with the previous case, we did a thorough history, just got to understand Shona as a person, got to understand her expectations, what she really wants, why she wants it, when she wants it for, all the details. And then she also mentioned as well to us in the history that she's had problems with whitening her teeth in the past, and she always found it really painful. So that was quite helpful to know as well. We then did a full orthodontic assessment, the smile analysis, the facial analysis. We took x-rays, and you can see this is an OPG x-ray, it's a full mouth x-ray. And I don't know if you can see, but there's a canine tooth in the palate. And that's basically why she's got a baby tooth still there, because the canine never came through, because there was no room really for it to come through, because of the angle it's growing through. So her treatment options to get her the smile she wanted were similar to the previous patient. So a line bleach and bond. However, there was an issue with whitening in her case, or the traditional sort of fixed conventional braces to kind of straighten the teeth. And to close, so for that sweet corn tooth, there were a couple of options. One option was to build it up, but because it was so broken down and fragile, and also it was moving a bit, it was never going to last. But we gave it to her an option, and we explained that to her, it's not going to last. Another option was to take it out and then replace it with with a replacement, tooth replacement. And the options really for tooth replacement in her case was a bridge. She wanted a fixed option, so she didn't want a denture. So a bridge or an implant. Another option was to bring that tooth down, that canine tooth down orthodontically. And that is a surgical procedure where we'd just attach, it'd be done by a specialist. So I'm not an orthodontist. I'm a general practitioner that's specialised in cosmetic dentistry. And that could be orthodontically moved down, but she didn't want to go down the surgical route. She said it's too invasive, and she decided that she wanted to straighten her teeth with Invisalign and have a bridge for that missing tooth, do bonding on the lower teeth. But for the top teeth, she actually decided she wanted porcelain veneers, because we both felt that her teeth may not be able to go as white as she wanted. And the reason that we did the alignment prior to the veneers was so that we could get the teeth to a point so that the preparation for the veneers was as minimal as possible. So this is her treatment planning. So basically, we've started off with the alignment. So I don't know if that video will play. Yeah, brilliant. And it was with Invisalign Go. And then we did actually try bleaching her upper teeth just to see how far they will go, because she wanted bleaching on the lower teeth anyway. So we're just using Invisalign trays as bleaching trays. And she couldn't do it. She managed 3 days of it, and she, no matter what desensitizers we used, we just couldn't get her teeth white as white as she wanted. So then we started the veneer process, and this is, one that I was mentored by Dr. Sam Jethwa. So he specialises in the handmade trial smile. So basically, this is a material called Luxabtemp and Luxaflow, which we use to basically hand craft a smile. So it's similar to composite, but it's just a flowable material. So we temporarily glued this onto her teeth until we were happy. And then once we were happy, we basically took a mold of it and sent it off to the lab. And we told the lab, this is what we want the shape of the teeth to be, because we've seen it in her mouth, we've seen it with her face. So the lab created this image for me, and then I used basically my iPad and a pen to basically draw how I wanted the teeth as well. That was more for the patient, sorry. But then below, these annotations were for the lab, just to explain to him aspects of the trial smile that I wanted to change. And you may see as well that we actually ended up adding on a non-prep veneer. And I should have really maybe added a picture of the preparation as well, but you'd see that there was barely any prep on any of the teeth. And that's because we did the Invisalign prior. And then once we fitted the veneers, we did bonding on the lower teeth, and then we gave her retainers just as before. So these are her results. So these are her before and afters. So big change. She was really happy. Unfortunately, we didn't get a reveal video. And this is her face. You can really see the difference, you can really see the difference in her as a person, a lot more confident. She's changed her hair as well. We often find that with patients, when we go through the journey with them, they just become more confident. And it's just so nice just to see other changes as well, and obviously her smile is, a lot is what she wanted. And she got that Hollywood look. And this is just a bit of feedback she wrote on her Facebook. She's so happy. And it's so nice, to see. I suppose that is a good thing about social media as well, that you can connect with your patients. And, when they post things like that, it's just a great boost. So just to summarise, just a couple of things, a few pointers which I thought would help. So my advice would be basically follow your gut, be prepared to work hard. Talk to others, who are successful as well. Create goals for yourself, but also don't be disappointed, if you don't achieve your goals. Invest in yourself. Everyone's journey is different. Know your strengths and weaknesses. Persistent, be persistent. Don't give up. Remember your successes as well, and believe in yourself. Learn from your mistakes, look after your body and mind. And also, cosmetic dentistry is a lot more than making things look beautiful. And it's important to be ethical and think about function as well. Okay, so that's my talk. So just thank you so much for having me. And if anyone has any kind of questions, I'm very happy to answer.
Yes, thank you so much, Dr. Shivani, for taking the time to be here with us today and for preparing this presentation. It was really experience and cases. So with that said, yes, we have a chat for you, if that's all right.
Okay, great.
So the first question is, what is one piece of advice you wish you could give to you, about dentistry and dental school?
Sorry, you were breaking up quite a bit there. I didn't catch what you said, so if you could repeat that again. Something about dental school.
Can you hear me better?
Oh, yeah, no worries. So the question was, what is one piece of advice you could give someone who you wish someone had given you during school and practice?
I'm struggling to actually didn't catch. It was breaking up a lot.
Yeah, sorry, Tiffany, you're a little laggy. I can go ahead and ask a question instead. Can you hear me better, Dr. Shivani?
I can hear you better. Yes, I can.
Okay, the question is asking, what is more aesthetic, same length of the lateral incisors to the front teeth, or the lateral incisor being shorter than the length in the front teeth?
What's the cosmetic term of the lateral incisors being shorter than the front teeth?
Yes.
I don't know if there is a term for them. So sometimes you can get peg-shaped laterals. So you can get pointy teeth, and it's quite common actually for laterals to be significantly shorter. I had that personal problem. I had that problem personally with my teeth as well. My two laterals were, aesthetically not in the right proportion. So I got edge bonding my laterals and then ended up getting porcelain veneers just to kind of make them more in proportion. So it's all about golden proportion. That's something else that you'll learn about, and the phi ratio, and basically, we use that a lot to help us kind of gauge. And the more you do it, the more you can kind of just see it yourself as well. Something is slightly off. So I'm not sure if there is a term for small lateral incisors.
But which one would be more aesthetic?
What would be more aesthetic?
Yes.
So I, like I said, in the ideal proportion, the central incisor height is the same as the canine height, and that's what we go by. And the laterals are very slightly above those teeth, but not too short. And there are measurements as well that we sometimes use, but I usually just go by visual. And also, it's important to talk to the patient as well. What kind of look do they want? Do they want the teeth to be more curvy? Do they want the teeth to be more straight? What's their personality like? Are they dominant personality? So you'd probably do more longer laterals, more squarer teeth if they had a dominant personality, whereas for girls who maybe wanted the teeth to look a bit more softer, we do more curves on the teeth. So there's so many things really to take into consideration, and it's not a case of one smile fits all. Cosmetic dentistry is, it's what it means to that individual person.
Thank you for your response, Dr. Shivani. Another question is asking, did you have any self-doubt or imposter syndrome in undergrad about getting into dental school, or what advice would you give to people experiencing this?
Yeah, self-doubt when I was going through a low patch. Is that what the question is?
Sorry, what was that?
So if you just repeat the question again, the line's a little bit not very clear.
Okay. Did you have any self-doubt or imposter syndrome in undergrad about getting into dental school? And if you have
definitely.
If you have any advice about people
and advice, So it's so, especially I think maybe now it's more competitive. There's a lot of people that are very similar to you. There's a lot of information out there. A lot of people know more, I would say, possibly. So it's very easy to feel like that. And I often did feel like that. I've learned over time that there's no need to. Everyone has their own journey. Whatever happens for a reason. And like I said, persistence, just believe in yourself, keep going for it, and it will happen. So yeah.
Thank you so much for your answer.
Yes.
Another question is, what do you find challenging about your profession?
What do I find challenging?
Yes.
So I think I'm very lucky because I love what I do. And I get a buzz from every case that I complete. And we build relationships with our patients as well. And, and there's so many positives, but occasionally, we may get a patient who has, who maybe their expectations we didn't fully kind of understand from the start. I can't really think of, maybe there was one, and, that's where it can sometimes get hard, when you don't meet a patient's expectation, and, you can start, it can really affect you sometimes personally, but it's the same thing, you have to focus on the positives and focus on what went well and just use that as a learning experience. also it's hard work, physically as well, mentally, you're constantly, you're in a close environment, you're speaking all day, physically on the go. So it's it's not the most easiest profession, but there's a lot of good things about it. And and once you find, there's so many avenues you can go down, but once you find what fits you and your personality the best, then that's great. And there's so many things you can do, from like teaching to being a periodontist to like being in the community. There's so many different avenues in dentistry, and that's another thing that makes dentistry such a great profession. So yeah.
Thank you for your response, Dr. Shivani. Another question is asking, do you have any regrets during dental school that you wish you could have done differently or changed?
Regrets in dental school?
Yes.
Was that? Yeah, so like I just remember that one, it was in first year, everything just got to me. And I took it very personally, and it really knocked me down. So I think my regrets would be, it's not really a regret, because I always think that, like everything happens and you learn from it. But yeah, I would just be more chilled. And I am a lot more relaxed about these things. I don't always, I think because I grew up always getting top grades, always being, at the top, I was kind of too used to that. And then all of a sudden there were other students that were just as good as me. And it and I took it quite, didn't really know what to do. But yeah, just don't be too hard on yourself, I would say. And it's very easy to be hard on yourself. So that is, big important thing, because mentally there's already a lot to take. And, the last thing you want is yourself kind of knocking yourself down. Just enjoy it. Undergrad is a great time. It's you don't get time like it. So make the most of it, enjoy the learning, and get mentors, get good friends, build relationships. And it's all, it's don't take it too seriously, don't take life too seriously generally, I would say.
Thank you, Dr. Shivani, for your response. We have another question that says, how did you prevent burnout during dental school?
Prevent burnout?
Yes.
Balance is so important. So I had a good soap like in Leeds. Leeds is a great university for students, and there's a big social scene there. So our dental group we were all very social. So so we just had that balance. Like if we worked hard, we'd also relax as well. And fourth and fifth year, socializing became a little bit more difficult because there were so many modules. But setting yourself goals, I would say, daily goals, not being too hard on yourself, and just taking a break, listening to your body. If your body's feeling tired, then just stop, have a breather, do some meditation, something like that. So
Thank you so much, Dr. Shivani, for your response. One last question is, do you have any study advice for students? How did you return all the information?
Retain all the information. I think everyone's different when it comes to retaining information. For me, I used to write things down a lot, and I still do that now. So I, on my iPhone, on my notes, have my things to do, because otherwise I'd forget. So for me, I have to write things down and just go over it, and actually kind of understanding things and making sense in your head. So not just learning facts, but kind of understanding why and how also is quite helpful. So when it comes to anatomy as well, I found anatomy quite difficult to retain, but just writing it down again and again not just reading, but maybe trying to draw out the anatomy and maybe having a few little memory things that can help you remember different things, so yeah, but everyone's different. And there's a lot of information at dental school. It's like A-level's nothing, you do one A-level like within a week, 2 weeks. So it is information overload, but you do find a way to kind of, learn and, being practical minded and putting some theory into practicality also helps.
Well, I would like to thank you so much, Dr. Shivani, for today's session. It was great learning from you. It's an honor having you and learning from all your cases and your journey to get into dental school and becoming a dentist. For everyone that's watching, be sure to check out our GroupMe chat. We'll be posting the quiz. You have 24 hours to take it. And thank you again for joining all this morning. We'll have our next session on Monday. We'll see you all then. Thanks again.
Great. Lovely to speak to you all. And any kind of questions, feel free to DM. Happy to help.
Thank you so much, Dr. Shivani.
Bye. Bye. See you later. Bye.
Bye. Thank you.